we created a perineal cutout, so it's a little bit easier and more foolproof when lining it up with the perineal cutout on the table. But this is like the traditional pink pad, traditional size, and it works fine. Just the key thing to remember, because Megan was telling me that you guys have had issues occasionally with the pink pad. I think you had mentioned that it overlaps. We'll have it overlapping a little bit over the perineal cutout occasionally. Just the key thing to remember with this is that we want the patient's sacrum and scapula in direct contact with the pink pad. So that's makes it a little bit easier when you're lining it up. The draw sheet, which you can see is sewed a little bit narrow, it's specifically sewn that way so as much of the patient's skin is in contact with the pad as possible, and it's supposed to line up over the or under the arch of the patient's back, so the small of the patient's back. So, I mean, luckily she had already set it up on the table so you can see how it looks. But I just want to go over like the different components of the kit. So the component that you guys order here at Loudon is the pink pad itself, the draw sheet, these Velcro straps that'll go over the patient's torso, and then you guys have pretty large size arm protectors. That's to protect the ulnar nerve. Those, once these are positioned on the patient's arms, these will be typically you'll tuck the draw sheet over the patient's arms and then fold it nice and tight underneath the patient's the arch of the patient's back. So just like the biggest thing to remember with this, so that, you know, again, the whole point of using it is to avoid patient sliding, is we want to make sure that there's nothing in contact with the pad and the table. I think you had mentioned that one of the tables that you previously had or still have is like maybe a little bit slippery, and so at one point the hospital was using like a gel pad, under the pink pad. That's essentially contraindicated. We're taught to never have any material between the pad and the table. So if there's like a draw sheet, a tablecloth, or a linen, you just want to make sure to just do a double check, make sure that this is laying flat on the table. The other key thing to remember, once we have the pink pad laying flat, is these Velcro straps. Megan had mentioned that occasionally, I guess some of the nurses or techs were putting this on or strapping it on pretty tight, and that was creating some rippage in the pink pad. Really all you need to do, like the purpose of the straps is to make sure that the pink pad's laying flat on the table, because once the patient is laying flat on the pad itself, their body weight's gonna do all the work, because and you guys can feel free to come and touch it and feel it for yourself, but it's very similar to like a memory foam where when the patient's skin is in direct contact with it, they're not gonna move. So we don't really need to strap it on super tight. You can allow for a little bit of slack on the straps. How I do normally strap the Velcro on the table is like so. So you can see that it's a little bit longer because some tables, I mean, every bed rail is going to be different on every table. Some tables, the bed rail is a little bit lower. You know, here it's pretty high up to close to the mattress. So what I do is I'll just loop it one time, or essentially 2 times, like so, and then I'll just strap it over top. So there's a little bit of slack. It's not strapped on super tight into the bed because, again, it's just all about laying it flat. So there's 2 sets, or there's a set on each side. So 4 straps total. You just want to make sure, loop it twice, strap it on nice and snug on the bed, and that it's laying flat on the bed. So that's always the first part of the setup. The second part is going to be the draw sheet, the lift sheet. Again, normally what I do when I set it up, and some of the pads that I've set it up on are a little bit longer than this one, but again, we want the patient's sacrum in direct contact with the bed, and we want this lined up under the arch of their back. So I'll normally set it up like slightly above the second set of Velcro straps. You know, you can leave it nice and long like this, because once the patient's laying flat on the pad, obviously we can use the draw sheet to reposition the patient. And then we want to keep it nice and long, like so that when we have the patient's arms tucked in, this is going to go over top. So do you guys have any questions, first of all, on the draw sheet or the pad itself before I keep going? Okay. So it's pretty dummy proof, but if you haven't been educated on it and there's been a lot of turnover, it's easy to get a little bit confused with the setup. Once you got the patient set up on the pad itself, the next component that you'll typically set up are the Velcro straps. So there's 1 strap on each side. And then how I always set it up, again, we're using this to try to mitigate skin irritation. You can see there's a Velcro strap, large Velcro strap on one side, and then there's a smaller Velcro button strap on the other side. I always just try to line these up to where this strap is facing up, and then this strap can go over top, because I just don't want the Velcro in direct contact with the patient's skin. And this doesn't have to be on super tight. You know, I'll get it on, I'll allow for like, typically, I'll try to allow for like maybe like my arm to be able to fit, or my hand to be able to fit between the strap and the patient's body, because when you get them tilted in steep Trendelenburg, a lot of times that can get more snug over their torso. We're just trying to, you know, limit any risk for injury. So, have you guys ever had any issues with that, the strap? So I mean, just, if you want to take a mental note, I don't know if you're recording this, I just would advise you to keep the strap or the Velcro away from the patient's skin. And then that brings me to the last component in the kits. So these are the Velcro straps. These are the arm protectors. I actually brought a sample. You guys can feel free to pass this around and just touch it, play with it, and just familiarize yourself with it. That's the Dermaprax material that's in direct contact with the patient's skin. That's the same material that's in some of the other components that are in the spine kits that we sell as well. And that's in a lot of the different new kits that we've come out with. But this is basically the same material as the pink pad, it just doesn't have the friction component, so it feels very similar. And it's designed to be open celled and breathable, so we're just trying to whisk away patient sweat. We're trying to, again, the theme is just trying to mitigate injury or any type of skin irritation. So with the straps, very simple. The one thing that I just want to remind you of, or just to advise you of, is that the Velcro strap, I always will tell the nurses and docs to line this up on the outside of the patient's arm. That way, once you have the patient's arms tucked, you have easy access to the IV. It's a lot easier, like, once you have the strap on, you're gonna have the patient obviously laying supine, and then the draw sheet's gonna go over top. It's not gonna be quite that long, but it'll go over top and be tucked under the patient's back. And you wanna be able to just get quick and easy access to the arm in case you need to, without bumping into the patient. If the Velcro straps are like on the inside of the patient's arm, occasionally you can bump up against the patient and, you know, potentially, create risk for injury. So I mean, that's basically the setup. If you guys have any specific questions, you can feel free to ask me. I'm happy to cover a case if need be. But I mean, it sounds like there haven't been a lot of issues recently. I think the one thing you had mentioned is that there's occasionally in cases there'll be like significant fluid buildup. The pink pad, I mean, it's designed to be open celled and breathable, so it's designed to wick away moisture, but it's really just trace amounts of moisture, like as a result of the patient sweating when they're intubated. It's not really designed to handle like copious amounts of liquid, during the procedure. So it's something to be mindful of. We do have fluid absorption mats that can be packaged with the pink pad that can help for like floor protection and just to avoid slippage. But it's just something to be mindful of. Again, if there's ever a fluid buildup between the pad and the table itself, that could result in like the risk for slippage, which defeats the purpose of using it. So it's just something to be mindful of. And we do have, again, I can individualize the arm protectors. I know some surgeons will tuck the arms and others won't. And so that way you're not wasting product, because these are single-use products. We can always package these individually. And we do have a pink pad with a perineal cutout that can make it a little bit easier to line it up on the table. But aside from that, you can feel free to reach out to me if you ever have any questions or issues.
So speaking of the perineal cutout, since we don't have the formed one that has the perineal matched to our cutout, if you're doing a lithotomy, you always want to make sure you're lining it up the edge of the perineal cutout. Line it up this way, not to overlap it, because any overlap is not really serving the purpose for the patient. You want their sacrum to be kind of right at the edge of the pink pad and right at the edge of the perineal cutout. So it would be lined up here. Obviously, the leg extension would be on this bed, and we would have removed the head for the shrunk bed. So that's important. If it's set up like this, we're always going to have to spend the time So, the other thing with the draw sheet, you know, if you have a really short torsoed person, even though this is set up in the general area where the small of the back is, it could still extend up into, I see this all the time, into the scapular area. So you may have patients where you need to kind of compress this a little bit to keep their scapula with good purchase on the pink pad. So just keep that in mind when you're tucking, and just observe where this is going under their back and make those adjustments before you tuck their arms. And like you were saying, you don't need to tuck real tight with the arms, and you actually don't want to. We've had some paresthesias, and they think as a result of too tight tuckage. So it just needs to be secured so that they stay where they're positioned, which doesn't require a whole lot of tightness. Any other issues that anyone has had with the pink pad? It's pretty straightforward. So what we were talking about, the moisture, that's why we started taking the cutout, the piece that we cut out of the sheet, to make sure that the pink pad is in contact directly with the mattress. That segment, especially if you're in lithotomy, when we do have a lot of fluid down here, during like a hysterectomy, or particularly a hysterectomy that's in conjunction with hysteroscopy, you want to make sure that you're taking that extra piece and either taking it like an inch over the pink pad underneath the patient's sacrum, not like fully under, but just enough to catch the fluid, or under the mattress, the pink, just slightly. But the main thing is that what you want to do is to direct the fluid, and this will ultimately be hanging down off of the bed, to direct the fluid away from the mattress. And the reason being is that we had fluid come, so we didn't have this. When we started using the pink pad, we didn't do this. We have fluid totally disintegrated this, like shredded, like it was dissolved. And then blood all the way up, fluids, so sanguineous fluid, all the way to the head, and underneath here, all the way to the head. It was a mess. So that's why we are using this barrier. So it's gonna be the piece that you cut out, and just barely, so that you have good sacral purchase on the pink pad, but you have protection here as well. You also don't want your patient sitting in fluid for the whole, 2 hours. You want your pink pad to be functional. So, any questions? That's good, pretty straightforward, but some things you would know, if you didn't know, you wouldn't think about doing. And the why behind it is nice to know. So, I think that's it.
That's it.